Now we're going to talk about some natural stuffs this evening, and this is a natural contraceptive method. Like, it's a way of trying to prevent pregnancy immediately after you just gave birth. So we call this the Lactational Amenorrhea Method. Okay, so we want to actually look at the effectiveness of this. Like, how can you be able to keep away pregnancy just by breastfeeding your child? Okay, so for the effectiveness, first of all, you should know that exclusive breastfeeding, that's you breastfeeding your baby back to back after childbirth, is very effective. Okay, up to 98% is effective at preventing pregnancy during the first 6 months. That means it is very effective, but within a range. Above that range, they can't really 100% vouch for you that it will be effective. So when practiced correctly, you should keep that in mind, and we'll actually talk about how to practice it correctly. That's the frequency of breastfeeding, and we'll also talk about exclusive breastfeeding and all of that. So effectiveness rate is within that 6 months about 98%, very effective. So typical use versus perfect use is you are meeting all the condition. The failure rate is about just 2 pregnancies in 100 women in the first 6 months. With the typical use, effectiveness will be slightly lower, because in typical use the person is missing out some breastfeeding times and all of that. Okay, so conditions for maximum effectiveness, just as what I actually promised you guys I'll be talking about. The baby is usually under 6 months old. The mother has not resumed menstruation yet. Okay, baby is exclusively breastfed. Okay, you're not giving the baby water, no solid, no formula. The baby is entirely depending on you for nutrition. So how it works is prolactin, the hormone responsible for milk production, suppresses ovulation. Okay, so by stopping the release of gonadotropin releasing hormone, okay, from the hypothalamus. So once it suppresses that, it will prevent menstruation, of course, so there's no egg for fertilization. Okay, so it will reduce the chances of pregnancy. So it becomes less reliable if the baby starts sleeping through the night or feed less frequently. If you are now breastfeeding your baby with other supplements, formulas and all of that, you understand? So the stress of you breastfeeding your baby always is not there again. Okay, then if the mother starts menstruating, okay, if the baby turns 6 months old, so at this point, if the mother doesn't want to give birth or get pregnant again within that time, she has to actually switch to another contraceptive method.